Assalamu alaikum. Today's topic of discussion is approach to weakness of body, which can be right side or left side, that is basically hemiplegia. And we are going to take it as a case of stroke basically. So in history of presenting illness, how we are going to start that, and we are going to cover the OD para, what factors and what we are going to mention in the history of presenting illness for a patient of weakness, unilateral weakness. For example, I would start like my patient is not diabetic, hypertensive for last 20 years, smoker for last 30 years, presented with a complaint of weakness for right side of the body, which was sudden in onset, 3 days in duration and non-progressive. Patient describes that he was eating his lunch when he started having weakness and felt he has lost his power in the right upper limb and the lower limb, involving both the proximal and the distal muscles simultaneously. This weakness is non-fluctuating and persists throughout the day, with no relieving and no aggravating factors. It is associated with numbness of right hand or arm and or not associated whatsoever, but you have to mention it. There is any abnormal sensation or any pain in the part of the weakness. There is history of facial deviation. However, there is no history of any tongue deviation, you can mention difficulty in swallowing, difficulty in breathing and speaking, and no history of any fecal and urinary incontinence, and there is no history of preceding excruciating pain at the back which may lead to loss of consciousness or any previous history of neck stiffness. So in this paragraph you have covered the concise OD para along with the causes which can be causing weakness of the body. So in the next, along with OD para, you have to describe few symptoms related to the lobes of the brain to reflect what part of the brain is basically affected in your patient. So for that you have to ask the patient whether he is right-handed and left-handed to localize for dominant and non-dominant lobe. For frontal, you have to mention that there is no change in personality, there is no difficulty in speaking. Then there is no history of blurring of vision, any double vision, any decreased vision, any hearing loss, any musical sounds in the ear, any preceding history of vomiting or recurrent history of vomiting after the weakness, any loss of memory, or if the dominant lobe of the parietal is involved, then there is inability to read, or you can ask that he is able to understand what you are speaking or not, whether he can do calculations or not, and for non-dominant, whether he is aware of his illness or not. You can mention he is unaware of his illness. Then for autonomic, if you have already covered difficulty in swallowing, speaking and breathing, here you can ask there is no history of any altered bowel habits, dry mouth or any dizziness on standing. Then for the care, or you can mention this is also the care and these are the causes basically we are going to rule out in case of stroke patient, in which, as we all know, that most common are the ischemic causes. So for atherosclerosis, if patient is having any history of diabetes and hypertension, you are going to mention it here. So in detail, with smoking, any increased blood cholesterol levels, you have to mention here. Then you have to rule out if there is any history of previous valvular heart disease, any prostatic heart valves, and then use of any monthly intramuscular injections, any dental extraction, any high risk sexual behavior, any pain in the lower limb on walking for claudication. Then for any prothrombotic and previous prothrombotic condition, any family history of thrombosis, any weight loss, lumps and bumps, any decreased appetite for malignancy. Then for hemorrhagic, if you haven't asked before, you can mention that there is no history of any use of blood thinning agents, any bleeding disorder, any bleeding from any other orifice of the body, any preceding headache before the weakness, any neck stiffness or any easy bruisability or any previous bleeding disorder. Then other differentials which you have to rule out in a patient with hemiplegia, that is, for PNH you can mention that there is no history of any cola colored urine, any history of any repeated blood transfusion, any retarded growth, then any preceding history of redness after hot bath, any redness of complexion, any oral ulcers, any skin rash over the face upon exposure to sunlight, any, if she is a female, you can ask for any repeated abortions, recurrent, any joint pains, any generalized body swelling and frothy urine, any if a patient has been diagnosed with any space occupying lesion in the brain, any trauma. Then you can ask that if she is having any recent pregnancy, any use of oral contraceptive pills, any surgery or prolonged immobilization for CVT. Then for infections, any previous history of tuberculosis, any IV drug abuse, high risk sexual behavior. For vasculitis, if there is any previous history of right-sided headache or pain on touching of the head, then any decreased pulses in the limb or any abnormal pulses or difference in pulses, any joint pains, oral ulcers, then any blood in sputum or blood in urine. You can ask for aortic or carotid dissection, any excruciating neck and chest pain followed by weakness, any use of drugs like cocaine, any previous history of high grade fever with discharge from pain, so discharge from ear, to rule out any cerebral abscess. Then for multiple sclerosis, you can mention there is no history of any weakness, previous history in the months for weakness which resolves on its own, any visual symptoms which resolves on its own, any unilateral headache before this weakness. Then what can be the complications for stroke? In every stroke patient, you have to mention that because the stroke patient, they cannot walk, patient has developed hemiplegia, for example, he might be having repeated chest infections. So you have to mention that the patient has no history of any repeated chest infection, any burning micturition, any bed sores, any fits, any prolonged immobilization leading to leg swelling and shortness of breath, any high grade fever, any abnormal flexion of limbs, any constipation, then any low moods or frequent weeping episodes. If the patient is catheterized and he is having NG tube, so you have to mention the care, what he knows about the care of the NG and Follies. Then here you have to mention the care for other risk factors like diabetes, hypertension, and the smoking. And if hypercholesterolemia, then that is also to be mentioned. Then, as we all know, then comes the investigations and treatment, that after coming to the emergency, he has been investigated with CT scan, MRI, or whatsoever. He tells what treatment he has been given, any antithrombotic therapy, any antiplatelet therapy. If he mentions, you have to mention it here. Then after investigation and treatment, then same as before, past history you must be mentioning, then the family history, hospitalization history, any travel and transfusion history, any vaccination history, then functional status of the patient, how this weakness has affected his life. He cannot move his arm and leg, he cannot go to the washroom, he cannot do his self-care, he cannot go to the job if he is working person. So occupational history you have to cover in this. Then the socio-economic status of the patient. So this was stroke and weakness of half of the body, or hemiplegia, and it's a very important topic. Hopefully it's helpful for you. Thank you. Don't forget to like the channel and subscribe it. Thank you.